Hey there, good morning. There we go, trying to figure out how to go live on uh, Instagram looks like I am now live on Instagram. So that's awesome. Good morning, everybody. Welcome. And I'm hoping I'm going live on Instagram. Yeah, I think that is there. All right. Let's get started. So today I want to talk about progress notes, and I don't know how long this type of note has been around. I think it's been around for a few years. It's been used outside of the United States. It's this concept called open notes. And open notes is a way of integrating clients into the documentation process. And so when I was researching, whenever I'm creating a new course, so I have a new course now, and I'll talk a little bit about that at the end. If you're interested, just make sure you stay tuned till the end of the broadcast. So anytime I'm doing any research for a new course that I'm creating, I always like to go and see what the research says. And while I was doing the research, I came across some research about open notes. And in the mental health field, I've been in some conversations about open notes and thought it was a relevant topic for a course about writing play therapy progress notes. And progress notes for mental health is something that we're usually always trying to figure out, especially in the beginning. It can be really overwhelming and confusing, not to mention exhausting if you're not exactly sure how to write progress notes. You can feel lost and confused in that process, which then makes it take longer because you're not sure if you're doing it right. Then you're worried who's reading them. Or if you're in private practice, you worry about getting audited and having money taken back. If you work for an agency, you may worry about that you may worry about like your charts not being up to speed and having to redo things, or worse yet, you're not doing them and nobody's found out yet. That happens as well. So I thought this whole topic of progress notes, specifically for play therapists, would be a really useful topic. It's not the most exciting topic. It's not the one we usually gravitate towards, because it's not usually our favorite thing to do. That being said, it is something we're required to do, and it is something that has a really important purpose. So in my mind, if we're going to be looking at progress notes and best practices for progress notes, why not go and see what the research says? And there's also in the United States, I don't know how many of you, if you're joining me, go ahead and post in the comments, or if you're watching on the replay, or if you're listening to the podcast, go ahead and post in the comments. And if you're living in the United States, have you heard of the Cures Act? So the Cures Act, I'll talk a little bit about the Cures Act as well, based on this study that I came across that I think would be really useful. And then I'm going to talk about how these are applicable for play therapy and some of the pros and cons, and I'll give my opinions about that. So I am Kathy Spooner. I'm a licensed clinical social worker here in the United States with about over 30 years experience in the child and adolescent mental health field. And I have written quite possibly a bazillion progress notes over the years. I have been in a position, a supervisory oversight kind of position, where I review progress notes. I teach people how to do progress notes. I audit charts. I do all those things. I'm going to be honest, auditing Medical records is not my favorite part of the job. That being said, over the last 15 years, I have come to realize it's an important part of my job to make sure that documentation is getting done correctly and meets standards and best practices. So I would love to know who's here. If you're watching on the live stream, if you're watching the replay, go ahead and post your name in the comments. Where are you from? What population do you work with? What play therapy modality you're using? What are your questions about progress notes or your frustrations about progress notes? The only thing that I'm going to ask is that we make sure to maintain client privacy. We not talk about specific clients just for privacy purposes, but general questions and general experiences, probably most of us can relate to some of the frustrations. Go ahead and post those in the comments and let's get started for today. All righty. So first and foremost, what are open notes? So open notes is a concept where really the clinician is co-creating the progress notes for each session with their clients. And based on this article that I was reading, the study, and if you're interested in this research study, I put the citation in the description so that if you want to look it up or if you have the ability to look it up, then you'll know how to find it. It was actually a really interesting study. So what they talked about in terms of the open notes outside of the US, countries have been using open notes in the medical setting and even in the mental health settings. However, what they found was that providers in the mental health settings have been reluctant to embrace this open notes philosophy. So some of the benefits that are kind of touted for open notes is that it allows for greater client engagement because they are involved in kind of a recap of the session. And that also allows them to have a better understanding of their issues, their diagnoses, even like in some settings, depending on what your setting is and your role in the mental health care, maybe even understanding their medication better. So when they're writing progress notes, then this involves them in the process. It also allows for greater accuracy because sometimes we make mistakes and write some inaccurate information in there. So the idea is that it's going to create greater accuracy and better client engagement, better treatment outcomes because clients have an understanding of what's going on with their care. Some of the concerns that have been identified with open notes, so the concern is that clinicians, because clients are involved in and participating in the writing of the progress notes, that clinicians are not going to be as accurate out of concern for client response when reading or hearing some information that they might not necessarily be ready to hear or even able to, depending on what their mental health status is and the issues that they're dealing with. So the concern is the progress notes are not really fully gonna reflect what's happening in the treatment process. And if you have clients that are higher acuity, and personality disorders, and if you're working with the family system, who's reading the notes, who's involved in the note writing, that can, especially if you're a family therapist and you're doing family sessions or you have multiple people in there, that can seems to me that'll be a little challenging to get done. So those are the kind of the pros and cons around open notes. So that kind of brings me to this idea of the Cures Act. And what is the Cures Act? So according to the article, and I'm aware of the Cures Act. So let me just make this statement. I am by no means an expert on the Cures Act. I'm not going to go into detail. Please don't take this as kind of legal advice about the Cures Act or what you should do. What I thought would be useful is to open up the discussion to have the opportunity to have some information as you're making your decisions and you're working within your agency or you're making decisions for your private practice and you're here in the United States. If you have already heard of the Cures Act, you're probably already considering how are you implementing some of this. If you haven't heard of the Cures Act, then it is probably something that you want to find out about, especially if you're in private practice. If you're in an agency, then the likelihood your agency has figured out how they're going to comply with the Cures Act is pretty high, hopefully. So what is the Cures Act? In the United States, it was enacted back in April of 2021. So it's been a couple of years. The Cures Act is really, in a general sense, it was enacted and requires clinicians to provide clients with access to their online medical records. So there is one caveat for that: psychotherapy notes can be excluded. It's at the discretion of the agency how they're going to manage that, but they can be excluded. So that's typically something your agency or you had to figure out how you're going to navigate the Cures Act. So in light of this idea of increased access to medical records for clients, so this is in the medical profession as well as the mental health profession. So in my mind, I thought, well, we have this, and there is this concept of open notes, this thing of open notes. So my mind, let's see what the research says about that. So some of there was a study done by a team of researchers, and the study is called The Benefits and Harms of Open Notes in Mental Health, a Delphi survey of international experts. So that's kind of what caught my attention. It was talking about the pros and cons of open notes. So the purpose of this study was to gather opinions regarding the benefits and potential harms of using open notes in the mental health field. And so they gathered these opinions from international experts in a variety of disciplines in the mental health field. And these participants had a variety of disciplines and they were in a variety of roles. So the participants in the study were clinicians, chief medical information officers, patient advocates, information. This is a kind of a tongue twister of word. Informaticians with research knowledge and experience about open notes. So basically people who are in the research field and they have been researching open notes. So really, if you think about the participants, it's a wide range of participants, from the kind of management side, the provider, clinician side of things, and patient advocates, as well as research professionals who have been studying. So they have different kind of knowledge and experience looking at open notes, so they know kind of different things to keep in mind when you're doing the study, which I thought was a great idea. And how cool that there are professionals in the research field that do these things, so to kind of root through any bias or missed things to think about for the research. So the findings of this study, so what they did, so a Delphi study is essentially you're getting experts in the field. You're giving them it's usually a 2 or 3 rounds of questions. And so the first round of questions, they have specific questions they ask. And the purpose is to gather opinions, and then the researchers will kind of narrow that down and create the next set of questions. The purpose is to get consensus from these experts in the field about the topic. And in this particular topic, getting consensus around the benefits and harms of using open notes in the mental health field. And so there were basically some mixed results from this Delphi study, which one of the things that there was consensus about was that the open notes would provide greater understanding to patients for understanding their treatment approach. There was also consensus that it would provide empowerment for patients about their treatment. There was neutral consensus about whether or not clinicians would accurately document or if they'd be less detailed to avoid problems. And then they weren't able to get consensus about what information should be redacted if appropriate and when that might be appropriate. So if you're allowing access for clients to read their medical records, if and when does information need to be redacted so that clients are not able to read that? And so with that one, they weren't able to get consensus about when that might happen. So in my mind, I look at this through the lens of a play therapist. So when I was looking at the research, what was clear is this study was done for medical records of adults. So it's really about adults having access to their own medical record. In the child and adolescent field, and I would say if you're a marriage and family therapist, this kind of creates some challenges as well. So some of the challenges from the kind of taking the information from this study, this idea about open notes, using open notes, co-creating your notes with clients in order to allow access to their medical records. Children have varying degrees of ability just based on what developmental stage they're in. So can you imagine doing an open note with a 5-year-old? That would be rather challenging and, in my opinion, counterproductive, because if the point of the play therapy session is to help with the healing process, trying to get a 5-year-old to co-create a note with you seems counterproductive to me, and it would take away from the play therapy session. Clearly, you wouldn't be able to do that with a 3-year-old. Clearly, you wouldn't be able to do that with a 7-year-old. I mean, you could probably do it with children who are a little older and like older elementary age, probably do it with middle school. You could do it with high school. In my mind, though, at what cost and what's the ability of the child to participate in this process? So there are a lot of pros and cons to think about with that one, having children co-create with you. The other thing is privacy, right? This is always something we talk about in the mental health field, is the privacy for clients and how much information do you share with parents. And children, I've had children as young as 5 play out something in the playroom and then get this worried look on their face because they're playing out being angry with a parent or someone. And they'll say something to me, share something in their play, and then get this really worried look on their face and say, "Oh, you're not going to tell my parent, are you?" Then I have to reassure them it's a private session. So I think there's a tendency to think that children, young children, don't worry about that. And that has not been my experience. Children, the whole ability for children to engage in the play therapy session, the individual counseling sessions, is that ability to have that free and protected space. And depending on the child, they may have a greater concern for their privacy. So we want to be able to manage privacy, because for children and minors, at least here in the United States, and I suppose outside of the United States as well, parents are the legal guardians. Parents are the ones making these legal decisions on behalf of their children. So parents can make the decision to have access to the medical records of their children. It's been my experience, though, if you're a play therapist and you're engaging parents as active participants in the play therapy process, if you're meeting with them on a regular basis and giving an overview of what's going on, and you're inviting parents to be part of the solution, which means you're really supporting parents, you're giving them some strategies and techniques, maybe depending on the client and depending on the issue that the child is working through. You may be bringing parents into maybe the last 15 or 20 minutes of the session where you're sharing what happened, and parents are learning the skills that you're teaching the child, because the parents are going to be the ones helping to implement that skill outside of the play therapy session. Or maybe you are doing parent-child play therapy sessions, or even family play therapy sessions. And in this way, involving the parents in there gives them an understanding of what's going on with their child, how their child is progressing, and what their role is. You're supporting parents to be part of that change process, helping them to make some changes. So when you have that, then they don't really feel the need to look at what's in the child's progress notes. And that way you can also kind of protect the privacy of the child. If you're just doing the individual sessions, you're protecting their privacy, because you're meeting with parents separately on a regular basis, and you're not really disclosing the specifics of the session. You're giving an overview for the purpose of what can parents do to help, and then you're focusing on parents. So when you're doing that, then you're still protecting child privacy, and parents don't feel the need to access medical records. Unless, of course, parents are in a high conflict custody dispute or visitation dispute, and then that's a whole other category of what's in the notes. And brings me to the other kind of con about having parents participate in sessions. So parents in these high conflict disputes, they might be reluctant to participate in the play therapy with you, or even meet with you individually, if they know the other parent is going to be invited in to take a look at what's going on. Now, these can be subpoenaed, and there's a whole process to go through. There's lots of tips. I go into this a little bit in my progress note course, because this is a question when you're talking about progress notes. There's tons of horror stories about progress notes and progress notes getting subpoenaed. There's so many horror stories out there and fears that people have, and there is a way to navigate that. That's something, it's not the main part of the progress notes course. It is a section that I cover just to give some tips about that. Again, not intended for legal advice or ethics advice, just something to consider as you're figuring out how you want to navigate writing progress notes and navigate your documentation processes. So those are some of the cons about open notes for play therapy, in my opinion, they're giant cons. Some of the pros for using open notes in play therapy, if you're working with teenagers, it might for them feel empowering to have a voice in their progress notes of what's said and what's not said. And if you're inviting parents, when you're doing parent sessions or some family sessions, then it might improve some of the accuracy if parents and teenagers can co-create those notes. And if they're looking at the assessments that you've done, that biopsychosocial assessment, to be able to ensure the information in there is correct. So overall, though, I think from a play therapy standpoint, for me, there are more cons for using open notes than there are pros. I think there are some pros depending on the specific client needs. Like if you have older children or teenagers, if you're doing a family session, you can invite them to participate. If you have parent and child, they're co-creating the note together, as long as it doesn't create more stress for them and it doesn't take away from the therapeutic benefit of the session. And to me, those are really big things to consider when you're thinking about the use of open notes. I thought it was an interesting discussion anyway, even for play therapists. One, because it is a topic that we can't ignore. Client access to medical records, especially here in the United States, since we have the Cures Act. And if you're a child and adolescent therapist, the likelihood you've encountered families that are engaged in high conflict custody and visitation disputes is probably pretty high. And then how do you navigate that? So having some other things to think about as you're creating your strategies and processes for writing those progress notes, I think it just kind of gives you a more well-rounded and more grounded approach that you're going to be coming up with. So let me just give a recap and let me give you a little disclosure. So my husband just left for work and my dogs are now in the room. So you're probably going to see my dog Luna if you're watching on the live stream now or you're watching on the replay. You're probably watching Luna walk around in the back, although she's sitting right now. What you may hear also are some really strange sounds because my little dog Lily has left, but she's likely to come back. Luna has a tendency to roll around and moan and groan on the carpet, scratching. Yep, Lily's back. She's going to go underneath my feet of my desk here and get cozy. Oh, nope. She's making her way around the room. Anyway, so if you hear strange, weird sounds coming through the podcast or through the live stream here, don't worry. It's just my crazy dogs because they like being in the room with their people. So, all right. So let me give you a quick recap about what we discussed today. All righty. First and foremost, open notes are a strategy in which you're writing your progress notes alongside of your clients. And the idea is it's going to get greater engagement with your clients in the treatment process, help them feel empowered in the treatment process because they have a better idea of what's going on. They feel like they have more of a voice in their treatment, and they have a better idea, better understanding of their diagnosis and the different strategies that are being used. And in the United States, open notes are one way for mental health professionals to be able to comply with the Cures Act. that requires patients to be able to access their medical records through their electronic health record systems. And in my mind, if we are looking at some of these new trends coming and what's going on, it's always useful to look and see what the research says. So this particular study that I reviewed today looked at some of the pros and cons, the benefits and harms, potential harms of using open notes as your strategy for allowing clients to have access to their medical records. There are pros and cons. There were some areas in which there was consensus. There was some areas in which there wasn't consensus. I would say for play therapists, for child and adolescent therapists, and I would even say probably for mental marriage and family therapists, the limitations of this study are that it was focused on adults and their individual counseling. So children don't have the same legal rights in terms of who gets to decide things in their life because of a variety of factors like their age and development. Makes sense while parents are supposed to be in charge and making decisions for them, right? So that makes sense. That being said, from a progress note standpoint, there are things that kids, they may not want their parents to have access. And parents involved in high conflict custody and divorce disputes or visitation disputes, they may not feel comfortable engaging in sessions if they have to worry about what's being said about their sessions. That being said, if they're involved in the open notes, they can have some voice in what is written. So I forgot to mention that part. So that might be a pro if for parts of play therapy, if you invite parents to co-create about their session. So there are some pros and cons even for play therapists and child and adolescent therapists and even family therapists about using open notes. So that is it for today. So if you're interested and you are feeling overwhelmed, confused, and just frustrated writing progress notes for play therapy, I do have a new course that's out. It's an online play therapy course, which means it's online. It's got pre-recorded modules with activities, so you can take it when it's convenient for you in your time zone. You could do it all at once, or you can kind of do modules at a time. The progress note, the course for the progress notes, essentially what I did is I really took my 30 years in the field writing progress notes and the best practices that I've learned, plus my experience auditing and dealing with different entities and different requirements. There are some strategies that are useful when you're writing play therapy progress notes. There's a lot of horror stories that people hear that make them anxious and overwhelmed and scared, which then slows them down in their progress noting process because then they don't know what to write. And there's, to be honest, in my opinion, there's a lot of bad advice out there about progress notes. And I have seen some bad habits about progress notes. So my intention for this course was really to walk you through step by step how to summarize what was done in the sessions into a clear, cohesive progress note that aligned with your play therapy theoretical model, that aligns with your treatment plan, so you can provide that clear documentation about your client's experience. So I take a look at how do you recognize themes in play therapy sessions and then translate that into a progress note. how do you know what to write and what not to write? And so I'll use case studies and I kind of walk you through what to look for and why it's important. I review 4 seminal and historical play therapy models so that you can make sure and get the idea of how do you align your progress note with your theoretical model. Because the other question that comes up a lot is, how do I write a progress note that looks like we're doing more than just playing, right? Air quotes, just playing. How do I write one that sounds professional? When I'm talking about the child played kitchen play and was cooking food and ringing it up on the cash register and playing with dolls or playing a game. How do I translate that into a professional sounding progress note? So I walk through how to align with your play therapy model, what kinds of structures you can use, and then there's some bonus models in there. The whole purpose of the course is, by the end of it, that it's going to help you write these progress notes for play therapy play therapy sessions in a way that sounds professional, that meets best practice, that doesn't take lots and lots of time. So it frees you up to do the other things that you really enjoy doing and avoiding burnout. So if you're interested in that course, it's called Getting Grounded in Play Therapy Progress Notes. And you can pop over to my website at rhplaytherapytraining.com. Click on the courses page. You'll see some of my other courses on there if you're interested in any of the other ones. The Getting Grounded in Play Therapy Progress Notes course is on there. There are play therapy CEs available. And so that is it for today, and I will see you next week. Bye for now.